Hello, you're welcome to this episode of Ask Dr. Ken. And what we're considering in today's episode is the reason for current rise in IVF treatment. Over 6 million babies have been born through IVF in the world today. 40 years ago, the first IVF baby was delivered. After the successful delivery of the IVF baby, there is a spark of controversy, criticism, and stigmatization all across the globe, especially in the European society, where the first test tube baby was conceived and delivered. Then it appeared that there was a setback in IVF. But then, owing to the doggedness and tenacity of the pioneers of IVF has lingered. Cultures, religion, and different society stigmatized IVF. In my opinion, because of lack of understanding of what IVF is all about. But today we see that there is a surge, there is a rise, and there is a rush for IVF treatment cycle. But what are the reasons? There is an increasing acceptance of IVF worldwide. The cultures that have been antagonistic and religious teachings that have been antagonistic also to IVF appear to have lessened, because there is now a better understanding that IVF is God's given scientific intervention to improve the lot of human and increase family satisfaction. With increased modernization or heightening civilization, and especially social and economic revolution, we have seen that a lot of women have taken to career, wanting to settle down for family life when they are advanced in age. And as we already know, that the quality of eggs and the reproductive potential of a woman declines with age. And when marriages are contracted at an advanced age, or when couples decide to have kids or children, or to raise the family at an advanced age, they are only going to be faced with challenges of the quality of the eggs of the female partner. And of course, oftentimes they may have to resort to IVF as a way forward. Modern diet and lifestyle, living in industrialized areas, exposure to unknown sources of radiation have also causes a depletion in the reproductive potential of the female folk. As a result of this, oocytes are deficient and people are resorting to IVF, seeking oocyte donation services. There is an increased acceptance among the religious folks, as we see different religious sects advising IVF as the only source or the main source or the main option of achieving pregnancy. IVF has equally become a lifestyle for some people, as people would prefer to have their kids without delay, even when there is a chance of having a spontaneous conception. Sometimes they want to plan their lives, have their kids in quick successions, and face their social challenges or economic challenges. Desire for specific sex has also increased the rate of acceptance of IVF. As we frequently see that couples having only one set of gender in the family desire gender balancing will recourse to IVF for sex selection services. And more recently, with the popularity of same-sex marriages, the chances of having spontaneous conception is almost zero, as couples engaged in same-sex marriage will have to seek fertility help from IVF center, either for egg donation or sperm donation, or even for surrogacy services to achieve pregnancy and also to raise a family. These are some of the reasons why IVF has seen the current rise in acceptance. For more information about IVF and reproductive care or services, you could visit our website www.arbshospitals.com, or even contact us through any of the social media handle, or visit our hospital for direct conversation with us. Until I come your way next time, I'm Dr. Kenneth Iguda, a consultant gynecologist, IVF specialist, and also a minimal access surgeon. Thank you.